Hello, I'm Dr. Marcia Shade, founder and CEO of Voice It Inc. I am also a nurse and researcher. Our startup focuses on creating innovative digital health solutions that engage, inform, and empower older adults. Before I go on, take a moment and think back to a healthcare visit where you were in pain and were asked to rate your pain on a scale of 0 to 10. I am sure several numbers flow through your mind. Now let's be realistic here. What does that number really mean when it comes to pain? Sure, a number can help indicate severity, but is that really going to get at your pain experience? It is time to think differently about how we evaluate pain. Why is this so important to me? Because of Myrtle May. My Granny Myrt lived in a small town in southern Oklahoma. She was healthy but struggled with chronic pain from arthritis. There were no in-town pain specialists that understood pain management in older adults. Pain care was an hour away. The lack of good pain care meant she ended up taking multiple medications for pain. She experienced medication-induced delirium and other negative health outcomes, escalating her health decline. She went from being independent to living in a nursing home where she died December of 2020, 10 days after her 99th birthday. My Granny Myrt's experience is a part of me and our family, as our family dynamic was forever changed. Unfortunately, what happened to my granny is not unique. The current system is failing older adults with pain. Pain is a pain. It impacts nearly 19 million older Americans and costs $200 billion in medical care and disability annually. Higher pain symptoms have higher costs due to clinic visits and prescription medication. In older adults, pain assessment is inconsistent and not routinely reevaluated. It's poorly managed in older adults, especially with health disparities and cognitive impairment. We have been doing the same things for decades and nothing has improved. Pain management is worsened by a healthcare workforce shortage. Our providers are overworked and burned out. Assessment and evaluation are impacted. In fact, the average time spent addressing older adults' pain is 2 minutes, which is not long enough. The documentation and tracking of pain within EHRs is mostly based on numerical ratings and qualifiers for those who are nonverbal. Pain is biopsychosocial, meaning it impacts us physically, psychologically, emotionally, and socially. The current status quo does not capture the older adult's pain experience, but at Voice It, we believe we can make real change by harnessing current innovations in technology. Our solution is Pain Chat, an app that uses conversational artificial intelligence to personalize pain management. Our app recognized that pain is more than a number. Pain Chat uses older adults' own words to capture their pain experience, bringing greater specificity to assessment and evaluation. I'm a fellowship-trained pain researcher and clinician. Pain Chat was developed based on evidence and my research. I understand the potential for technology-driven interventions and the preferences for pain management software foundational to the development of Pain Chat. Pain Chat will interact with older adults in real time within their natural environment. The accessibility of Pain Chat derives information directly from the older adult to provide a narrative of their pain experience guided by engagement with AI. As technology continues to advance, there is a potential to detect pain in the human voice as a biomarker. Alerts will be triggered based on conversations that fall outside pain parameters. Pain Chat will not replace the healthcare provider, but help older adults share their story and capture it within the EHR. Our primary segment is healthcare providers who will have patients use the app as part of their pain management services. The TAM is $16 billion. The SAM is $483 million. The SOM is $144 million. Several factors are driving the growth of the market, including the increasing prevalence of chronic pain, the aging population, and the rising cost of healthcare. Voice It Inc. is well positioned to capitalize on this growth. Our solution is clearly the front runner in relation to other technologies like traditional mHealth apps that have poor uptake in older adults. Our solution is geared specifically for older adults. Pain Chat is a more natural way of disclosing the pain experience in the moment. Our technology allows for personalization and incorporates machine learning with natural language processing. With Pain Chat, older adults control their pain narrative, giving the provider more accurate data to make better clinical treatment decisions. As of now, our innovation is protected under common copyright. Our IP will be based on our unique machine learning model. We are in the process of negotiating with the University of Nebraska Medical Center Tech Transfer Office regarding IP. Our go-to-market strategy is realistic. We will have the Pain Chat app available for download on iOS and Android devices. We will ally with national pain organizations and medical societies. Voiceit would partner with healthcare organizations. Their healthcare providers will be able to offer the app as part of their pain management services. Revenue will be generated from subscription fees for Pain Chat access and integration, underscoring our strong ROI potential. Pain Chat can reduce healthcare costs by preventing unnecessary interventions, reducing prescription use, and minimizing complications from undertreated or mismanaged pain. Other benefits are improved pain management and enhanced quality of life. App development has been ongoing throughout the NIA challenge, and we will have a functioning proof of concept December of 2023. Voiceit is now a Delaware C Corp. The American Society of Pain Management Nursing is funding our proof of concept, and we have applied for $50,000 to fund our prototype. In January of 2024, we will solidify Voiceit's 5-member board of directors. Our diverse advisory board will have health provider stakeholders, older adults, and business development consultants. The Pain Chat prototype will be ready August of 2024, and I will continue to seek funding to support MVP creation to be released to the public by December of 2024. We will use the $60,000 from the NIA Challenge to continue building Pain Chat and secure resources to conduct continuous customer discovery, business development, and marketing. At Voiceit Inc., with our expertise in pain and technology, we are more than qualified to see our innovative Pain Chat product to market and grow our startup.